your opening remarks.
Good afternoon, Madam Chair and members of this committee. My name is Jeff Wilkins, and I'm the National President for the Union of Canadian Correctional Officers. And I greatly appreciate both the invitation and the opportunity to speak with you all today, and hopefully I can help answer some very important questions that you may have regarding the government's response to COVID-19. I'd first like to express my pride in representing such an incredible group of professionals who have worked through this pandemic and continue their work in the face of the invisible threat that we have named COVID-19. Before the global pandemic, our members worked daily in one of the most dangerous environments imaginable. And today, in the midst of a global crisis, they bravely continue their work with an additional personal risk. And for this, they have to be commended. The members of the Union of Canadian Correctional Officers, or UCCO-SACC-CSN, have only ever asked one thing from the government outside of our negotiations, and that is to have the protections in place to make sure that all potential dangers to our health and safety are mitigated to every reasonable extent. And this demand remains in the face of COVID-19. Correctional officers as first responders are not able to simply go home. Just like other frontline workers, we need the proper protection to do our work safely. However, safe work looks much different in an institutional setting than any other area of Canadian society. Our members are required to constantly balance the threat of the virus itself with the threat of institutional unrest. One major issue that has affected our membership in this crisis is the conflicting advice from different provincial jurisdictions of public health and the Public Health Agency of Canada. And this has proven problematic for our members in the areas of viral testing, social distancing bylaws, as well as contact tracing protocols. Each of these are very important weapons in the fight against this virus. However, each is managed differently for our members depending on the province in which they live or work. Some provinces would test our members if they were suspected to have been in contact with a known case, while others would not test unless someone was symptomatic. At the onset of the virus, some provinces quickly limited group gatherings, while some did not. And some provinces had different rules for what was defined as close contact in a contact tracing investigation. And these issues of jurisdiction are ones which raise various issues for our members. Another major issue is one of personal protective equipment and mask wearing within our institutions. The Correctional Service was very late to engage the various levels of our health and safety committees with regard to the policy and use of PPE. It was late in March that the first meeting of the National Health and Safety Committee was called, and consultation continued well into April before any personal protective guidelines were sent to the locals for consultation. I can only chalk this delayed response up to the lack of preparedness by both public health and the Correctional Service. Our members also experienced a significant cultural shift with regard to face coverings. Before the announcement by Dr. Tam in April, our members faced discipline if they chose to wear a mask that was not prescribed by the employer. And today, they face discipline if they do not wear one. In my opinion, this advice was too late, as we were already experiencing some significant outbreaks, and I question why this guidance was not already contained in a global playbook on the pandemic response. Because I believe, had wearing a mask been part of the culture at the beginning of this crisis, I believe that some of our outbreak sites may not have been impacted to the extent that they were. Since our first case of COVID-19 toward the end of March in the Quebec region, 5 of our 49 institutions have experienced significant outbreaks, and we have had almost 100 of our members infected by the virus. Over the past 2.5 months, our members have proudly continued their work, but they've grown tired and anxious for an end to this pandemic. The past 2.5 months, however, will not come without a cost, and I want to impress upon this committee that the government will need to take real action and calculated steps now, and most certainly in the wake of this crisis, to protect and accommodate the mental health of correctional officers. It is no secret that there exists a strong correlation between an increased risk of mental injury and the correctional officer occupation. Our members are working under extraordinary circumstances and in heightened states of anxiety, which will undoubtedly have significant impact on well-being and mental health, and it needs to become an area of immediate focus. To conclude, working through this crisis, it's very clear that not only the Correctional Service, but Canada as a whole was ill-prepared for this pandemic. Though the service did react each time local crisis emerged, the fight against the virus has been a reactionary in nature. And hindsight always being perfect, however, I believe had proper steps had been taken when the seriousness seriousness of this crisis started to be widely known and had real consultation occurred with local frontline officers and the union, many of our institutions would have been much better prepared. We must remain vigilant and ready for potential future waves of this virus, but we must also start to think of safe ways that we can get back to what will become a new normal. UCCO-SACC-CSN demands that the government adequately consults all stakeholders in our return to normal operation and weighs every decision in the interest of health and safety. Thank you.